Hello, my name is Rosie Feldman, and this is my presentation on human immunity. The first section of this assignment is the understanding of non-specific defenses against disease. An infection occurs when microorganisms such as bacteria and viruses invade the body. This is usually through the nose or mouth or cuts through the skin. Bacteria are single-celled organisms that cause illnesses such as pneumonia and meningitis. Viruses are different to bacteria in that they need a host to replicate and survive. Diseases that are caused by viruses include common colds or chickenpox. Skin diseases such as athlete's foot and ringworm are caused by fungi, and parasitic diseases such as malaria and scabies are caused by parasites. Infections can, however, be transmitted via direct contact, indirect contact, insect bites, or food contamination. Indirect spreading of infections occurs when bacteria or viruses are transmitted onto a surface for another person to touch and transfer to their own body. In most cases, this is via the mouth. It is thought that the common cold can survive on indoor surfaces for days, and its ability to cause infections drops over time. Insect bites can also transmit infectious diseases via characters known as vectors. The common transfer method for bugs such as ticks and mosquitoes. Food can also easily be contaminated with bacteria like E. coli, which causes food poisoning and can make a person feel unwell. The body has 3 lines of defense to protect our cells and vital organs from infection. The innate non-specific defenses are mechanisms that prevent pathogens from entering the body or eliminate invaders. These are genetically programmed and happen autonomously. The skin is the body's largest organ and the most prominent physical barrier of defense. The epidermis acts as a waterproof covering that prevents the penetration of microbial organisms, chemical irritants, and toxins. If the skin becomes cut or grazed, it can heal quickly, forming a scab to act as a temporary barrier while the skin heals itself. The saltiness of the skin and the normal flora are also innate defenses, as the conditions do not provide the correct environment for bacteria to grow. The human body is also able to fight microorganisms using different enzymes found in the secretions of internal mucous membranes. They are responsible for filtering infectious enzymes. Intestinal bile and secretions and bile secretions can all be found in the gastrointestinal tract and provide chemical barrier against injection. The movement of a chyme through a digestive system via peristaltic contractions also help to remove microorganisms that may cause harm. Up to 70% of our immune system is located in our gastrointestinal tract, which demonstrates how important it is to keep a healthy gut. Pathogens can also enter the body through the nose, which is why our nasal cavity is coated with sticky mucus that traps the microorganisms before they can travel into the area. This is not always 100% effective. We humans have tiny projections called cilia on the lining of the area, which sweep particles up to the throat where they can be swallowed into the stomach. One of the main areas prone to infections in female is the urinary tract. It may have an effective barrier to infection. The female urethra is short and can provide a passage for external bacteria to travel into the bladder. However, most bacteria will be flushed out when the bladder empties, and that's true for both sexes. When an injury occurs, the body creates an inflammatory response, which is the innate immune system's response to infection or damage involving a number of different cellular events. The physical effect include blood vessels dilating and forming gaps in the cell wall. This allows large blood cells to pass through, increasing blood flow, which can cause swelling and inflammation around the injury. The injury may feel swollen and hot to touch due to the extra blood and proteins attracted to the infected area. Pain is caused by inflammation. The inflammation is one of our second line of defense and is vital as it isolates the area, reducing the damage from spreading, which also prompts healing. In the diagram shown, you can see an example of how chemical and physical response to injury promotes the attraction of leukocytes and produce a systematic response to promote healing. This process is known as inflammatory response or second line of defense. The next section of my presentation will cover section 2 of assignment brief. I'll be talking about the understanding of specific immunity. proteins are produced by various cells to enhance the immune response through signaling, mediating inflammation and immunity. They are complete proteins. There are more than 30 complement proteins in total that activate when triggered by a pathogen. They interact with each other to create clusters of reaction, attracting phagocytes to remove unwanted particles, innate inflammation, and produce proteins to attack unwelcome organisms. Antigens can be found in pathogens and help invade the body. They cause immune response in the body by telling cells that there is an attack. Lymphocytes are a type of white blood cell that can be found in the lymphatic tissue around the body. There are two types of lymphocytes, both T cells and B cells. T cells mature in the thymus gland and function to help destroy problematic cells such as pathogens or damaged cancerous cells. Helper T cells, and the most common type, help regulate most of the immune function in the body by releasing lymphokines that stimulate other T cells so they can attack foreign bodies. B cells mature in the bone marrow and produce antigens when they are activated. Plasma cells are a type of B cells that secrete antibodies into the circulatory system to provide immunity and memory. Memory B cells store the memory of specific antigens in the lymph nodes to be used when required. Immunoglobulins have many different functions, including neutralizing toxins, removing antigens, and recruiting immune cells. The chain of immunoglobulins are arranged in a Y shape, the smallest chains having the ability to bind to antigens. It's named after a type of heavy chain they have. The most common variables are shown on this slide. Both IgA types are known to have antiviral properties. Their production is stimulated by oral vaccines and aerosol immunization. When IgE attaches itself to cells within the body, such as those of mucous membranes or skin, the cells become sensitized to allergens, causing them to release histamine and histamine-like substances when they come in contact with the allergen, such as allergic reactions as hives, hay fever, asthma, and anaphylactic shock are manifestations of the IgE mediated reactions. It is the major antibody in the secondary humoral response of the immunity, serves to activate the complement system, and is frequently involved in opsonization. IgE is the only immunoglobulin that can cross the placental barrier. IgM is principally concerned with the primary antibody response appearing soon after initial invasion by an antigen, and is capable of destroying the antigen when it's first introduced. Antigens that are found throughout the body and are also in harmful pathogens are used in the immune system, so it knows where to attack or not, when to attack or not, where to attack or not, depending if they are foreign or not. Foreign antigens are found in pathogens and are further remembered by B cells when in the body, triggering antibody production when recognized. All nucleated cells have unique surface molecules that identify themselves and are known as self-markers and named major histocompatibility complex molecules, also known as MHC class 1. Its self-tolerance means it won't attack cells with one of these markers, although in rare cases a person may develop an autoimmune disease, which happens when T cells or B cells are activated against self-antigens. The reasons why yet to be known. Hypersensitivity is an occurrence of abnormal immune response caused by repeated exposure to the particular antigen. Hypersensitivity diseases can be grouped based on their underlying causes, as seen on the slide with some examples. Autoimmune diseases can occur all over the body. They can cause a handful of different symptoms. Fatigue, muscle aches, low fever, and inflammation are the main ones. Diabetes is a lifelong condition that causes a person's blood glucose sugar level to become too high. There are two types, type 1 and type 2. The pancreas is responsible for producing enough insulin in the body to help break down foods. Type 1 diabetes is when the pancreas doesn't produce any glucose at all. Diabetes is an organ-specific autoimmune disease. If the blood glucose levels get too high in the body, it can cause serious health problems, and unmanaged can lead to death or loss of limbs. This happens when the body immune defenses target the pancreatic cells as harmful and attack them. Without insulin, your body will use the fat and muscles to break down, causing rapid weight loss as a result of the body being able to produce its own insulin. People with type 1 diabetes have to inject the correct amount of insulin units per the correct amount of carbs they are eating. This is so that there is enough glucose to break down the food they've eaten, but not too much so the body overworks to clear it from the bloodstream. Type 1 diabetes is not able to be cured, but the aim of medical professionals is to make the glucose levels even and consistent with the aid of blood sugar tests and insulin. Another common autoimmune disease is multiple sclerosis, or MS, defined by the NHS as a condition that can affect the brain and spinal cords, causing a wide range of potential symptoms, including vision problems, arm and leg movement, and sensations and balance. There are two types of MS, the most common being relapsing remitting MS, which presents in the episodes of worsening symptoms before slowly improving over a similar time period. Treatment for MS includes short courses of medication and treatment for specific symptoms such as bladder control and muscle stiffness. An organ transplant is carried out to the correct organ malfunction with a healthy organ given by a donor, and is often a life-saving operation. Similar to what I've mentioned previously, sometimes the immune system does not always accept the donor organ, viewing it as a foreign agent. This situation is known as a rejection of transplanted organs. To improve chances of that, the body will accept a new organ. Healthcare providers try to closely match the donor to the recipient using a procedure called tissue typing. In medicine, containing monoclonal antibodies is also used during and after surgery to fight T cells known to cause the rejection. If the rejection does occur, it will be one of the three types shown here. The most common is acute, as all recipients will experience some kind of acute rejection. An example of hyperacute rejection would be if a recipient is given the wrong type of blood, the wrong blood type. Moving on to the final section of this presentation, showing the understanding of biology of vaccination. Active immunity describes as a resistance to specific disease by creating antibodies both naturally and artificially. Active natural immunity, such as common cold, develops from exposure to specific pathogens. There are many different strains of the common cold, but if your body is already exposed to one, the immune system remembers using B cells and stores immunity to that particular strain. Artificial immunity is gained when the body receives a vaccine containing antigens. This reaction stimulates the production of antibodies and memory cells in the same way as an active response. Should the body be infected with naturally occurring antigens after vaccination, it will attack and destroy them before the symptoms of a specific disease even develop. This process is known as immunological memory. Natural passive immunity is when the antibodies are passed from person to person. Example, mother and unborn baby. Immunity is passed down this way and can provide protection for upward of 6 months. Artificial induced passive immunity is when the person receives antigens made by someone in a form of injection or transfusion. Protection for AI passive immunity only lasts a few weeks, as the immune system itself is not stimulated by this method. Vaccines reduce the risk of getting a disease by working with your body's natural defenses to build protection. When you get a vaccine, your immune system responds. It recognizes the invading germ, such as a virus or bacteria, producing antibodies. Antibodies are proteins produced naturally by the immune system to fight the disease. Remember the disease and how to fight it. If you're exposed to the germ in the future, your immune system can quickly destroy it before you become unwell. Once your immune system knows how to fight a disease, it can often protect you for many years. The first time a pathogen is fought in the body, the process that occurs is a primary response. The lymphocytes identify the antigen, and it takes time for the plasma cells to produce enough antibodies. Symptoms will take hold of the body during this time. As the body encounters the same pathogen, it will react with a secondary response, which is much quicker than the primary response. The memory cells are able to quickly recognize the pathogen and produce the required antibodies to fight the antigens before any symptoms occur. Measles is an infection that spreads very easily and can cause serious problems in some people. Having MMR vaccine is the best way to prevent it. It's a highly infectious disease which can lead to serious complications such as pneumonia. This chart from Public Health England showing the number of record cases of measles from 1990 to 1995 in England and Wales. The first vaccine was introduced in 1968. And as you can see from then, there was a massive drop in record cases. It has a huge impact of the number of cases. The second vaccine was introduced in 1988. Public Health England shows that no more than 2 people a year have died from measles from 1999 to 2017. 2,016 cases of measles were reported in 2012 and 1,287 were reported in the first 6 months of 2013. There is no known reason why there is a rise in measles cases. However, parents are being urged to be sure that their children are vaccinated with the MMR vaccine. There are several articles linking MMR and autism, which is believed to be the reason for parents not getting their children vaccinated. However, this evidence is not scientifically proven. Herd immunity. Herd immunity is passing on immunity to those people who cannot be vaccinated. Example, newborns or sick people, without them needing to come into contact with the pathogen, both naturally and artificially. The concept idea comes from the belief that if most of the population is protected with a vaccine, it's less likely for infections to be will be spread. Problems occur during an outbreak before the population really reaches a level of immunity high enough to reach the herd immunity. Pathogens can present with variants of antigens, making it difficult for our body to protect itself against all specific antigens. Also, pathogens have antigenic variability and have the same problem as antigen variants. Issues can also occur in pathogens that can affect the threshold of vaccination required to prove herd immunity. It's considered more difficult to achieve it in current times as the world is more globally connected, making us vulnerable to global pandemics. The recent and most memorable was the SARS-CoV-2 outbreak in 2020, also known as COVID-19. Whooping cough, polio and measles were common causes of child death before vaccinations were introduced. The World Health Organization says without vaccines we're at risk of serious illness and disability from diseases like pneumonia, tetanus, polio, measles, and meningitis. The WHO estimates that vaccines save between 2 to 3 million lives every year. In 1979, WHO declared smallpox has been eradicated by a worldwide immunization program, and polio has not been seen inside Europe since early 2002. Another example of a worldwide vaccine program is COVID-19. I'm sure you're all well aware of what coronavirus is. It was first identified in late 2019 and vaccination started in the UK in December 2020. It's still ongoing, but around 57 million vaccinations have been given and more than 1.4 billion worldwide. In the UK, that the child vaccination program consists of 11 plus vaccinations covering diseases from tetanus and polio, influenza and mumps. These vaccinations are given at specific stages of child life and administered by a healthcare professional with parental consent. To increase vaccine uptake over the years since they were first introduced, the NHS have included pharmacists in the list of medical professionals who can administer vaccinations. Some people choose not to get vaccinated. They are known as anti-vaxxers. The main reason behind this is due to low confidence in vaccine, distrust, access barriers, incontinuance, lack of vaccine offers, or lack of communication from trusted providers and community. But overall, we've seen major gain with the vaccine. This is the end of my presentation. Thank you for listening.